So let me introduce our speaker for the next session. He is a distinguished expert in disaster management. He is also he has worked in the world's most challenging situations. Through his illustrious career in Doctors Without Borders, he has been pivotal in establishing a temporary hospital setup in the war-torn town of Mosul. So let me welcome Dr. Murtuza Ghiya, Senior Clinical Fellow, Critical Care and Echo, NHS UK. So, okay, sir.
Hello, good evening to you all. I'm just wondering why, for some reason, I'm unable to share my. I've shared my screen, but as you can see, it's empty. Just tell me if this
Um,
is.
okay, let me check, sir. Just a second.
Yeah. So, meanwhile, just to tell you a bit of my background, I worked as an associate professor in emergency medicine in a medical school in Mumbai. For the last 1 or 2 years, I've been in UK trying out different things. Just like any other disaster, a person interested in disaster would be leave a zone of comfort and enter a zone of discomfort. So that's what I've done coming to UK. It's not entirely by coincidence that my backdrop is tremendously ordinary with one silly looking door behind me. I think it's symbolic for us in disaster management to sometimes think that we do disaster management because we want to help people. We can help people best if we can first help ourselves. So, one of the rules which is seldom spoken when it comes to disaster management or emergency care is take care of patients, but take care of yourselves first. So, in my room now, for example, if something goes wrong, which could also mean my wife sitting here and getting upset with me, I've got the door, I can just run outside. So, I am taking care of everything, but I'm taking care of myself first. Because that's the best way to serve people. Serve yourself. Nothing selfish in that at all. Having said that, I'm just wondering if there's a way to get me to share my screen. I'd like this to be fun and informal, which means people can drop in not just questions, but just thoughts, comments, smileys, whatever they are called. So any of those emojis are okay with me. It just motivates me to keep the session as informal as possible. Now, we are sharing a screen, but
Yes, sir.
not the PowerPoint for some reason.
So, can you stop sharing the screen now?
Oh, sorry, apologies. Thank you. So I've already got a thumbs up. Motivated now. So quickly, I wouldn't want to waste organizers' time because they've been so particular about being punctual and sticking to time limit. I just want to bring in a new understanding of disaster management. The reason I do this is because when we go as responders, we need to be aware of why we are doing this kind of work. Usually, and almost always, let me just say, it's because we want to help. But there are various undertones of why we do this kind of work. My understanding, and this is when I was asked, why do you want to do something like this? You're sitting pretty as an associate professor in a medical college. Why would you want to go on and pick up an unnecessary challenge to your own existence? Uh, I obviously felt a bit like a hero, but in my head, I knew I was doing it for multiple reasons. The multiple reasons I'd like to share by the virtue of a poem. I wrote this about why I went to Iraq, and it's not entirely a selfless decision. As you can see, I told about taking care of myself, which is part of what we do with Code Blue Holistic Wellness Solutions. It's like a small startup in India that's helping healthcare professionals take care of themselves for their own wellness. Next slide, please. Oh, I think I can change the slide myself. Superb. So just to remember, I've taken a due consent from all people involved. Next slide, please. These views are my own and they do not belong completely to Doctors Without Borders, which is obviously an international organization. So we have these contents here. Main purpose will be today to discuss on content number 1, which is the purpose of humanitarian medicine. If there is time, we'll discuss 3 challenging cases. I'll skip that and discuss the Iraq situation, which may be a bit more interesting for people. And the fun part, maybe the cultural challenges, or rather, I would say the thrill of working in a multicultural team. So let me, next slide, please. So the first steps was obviously for me, why am I doing this? Next slide, please. Yeah. So the main purpose, next slide. Yeah, next slide, please. So I'll go on in terms of this poem. It's called The Partial Truth. So maybe it's a travel bug that makes us tipsy, and we can justify it by being a humanist gypsy. I'm wondering if there's a way I can share so I can control this a bit better. For some reason, this is a bit difficult for me. Just one moment. I'll just try sharing my screen again. So the big question was, why did I want to do this? And I told myself, maybe it's just a travel bug that makes us tipsy. We enjoy it, and we can justify it by being a humanist gypsy. Maybe it's the ER, the promises it could belie, and we go in its pursuit for the adrenaline high. And that was something that I tell myself, that it's not entirely selfless. I did it because I enjoy it. I did it because I think it's thrill. I get to see a new culture and things like that. Now, the first step was the hardest. To joining Doctors Without Borders. The first step was hardest simply because it required a lengthy application process. This was a 6-page application, multiple emails and interviews later. I was finally off to Iraq. Of course, more and more paperwork. As you can see, I was going to Iraq, Mosul, where the Battle of Mosul was fought by ISIS and the combined forces of what they call the Shia militias, the Iraqi government, the Kurdish forces, everybody combined against the ISIS in Mosul, and that is called the Battle of Mosul. But as you can see, the visa, so to speak, that I have here has nothing to do with Iraq indirectly. It's the Kurdish region. And the reason is I actually had to apply for 3 different types of visas. I would call it inverted commas visas, because the geopolitics was so confusing that you can't enter one area if you don't have the adequate clearances from the other regions. So I had 3 visas, and that's how I finally landed in Baghdad. And you can see this. So here, I'm going to see if at least my pen starts working. So can you see the green spots that I'm making here? I'm making a green heart.
Yes, we can see.
Oh, you can. Okay, the heart didn't come through, but okay. So Mosul is here. Yeah. And I landed in Baghdad. The reason was simple. It's because Baghdad was where the starting point was. From here, we got all the visa work done. But before Baghdad, they put me in Erbil because they wanted me some safety clearance from here. Now, from Erbil, you would think that I can just travel to Mosul, but instead they sent me all the way down here. The reason was this region was not safe for travel. So I came here and then traveled all the way up. And in this process, I got some security clearances done for myself. Moving on then to the next slide, showing you West Mosul now. This is what West Mosul looks like. The time I went there, just after the Battle of Mosul, to be honest. So this is what West Mosul looked like. And you can see here that the entire bridge was collapsed. And this is where I want to ask a very interesting question to everybody. And think, there were apparently 6 or 7 bridges that connected West and East Mosul. And 6 of them were destroyed. And when the car was taking me on the 7th not destroyed bridge, I asked them, my God, ISIS is horrible. They destroyed 6 bridges. And my driver told me, no. It's the army that destroyed the bridges. I was completely shocked. Why would the army of a country destroy its own bridges? Does anyone want to guess why somebody would do that? Why would the country, the army destroy? Anybody?
To keep them contained in that region.
Yeah, it's very, very interesting. To contain, so ISIS was like a virus, let's say, and it was largely coming from West Mosul, and they could travel to East Mosul via these bridges. So just to contain them, the army themselves destroyed the bridges, so ISIS doesn't move. Fantastic, so superb. These are some of the other images. As you can see, widespread destruction. This was a small stadium that they were planning to build, completely destroyed by the ISIS. These are the housing areas. Simple areas, even which are not directly affected by the main battle. You can see they are just bullet marks on every single wall. It's pretty disappointing when I had to go through all of this to reach my hospital. My hospital, of course, was a makeshift hospital. It wasn't really a hospital. It was a steel tent that was made by the MSF team. Now, because this is a medical conference, just to tell you the limitations that we deal with. Normally, we know that this is a standard prescription for asthma exacerbation. And what we like is when we use an inhaler, we always use a sort of a device that extends the ability of the inhaler. And that device is called, anybody? Spacer. Yeah, a spacer can cost so much money. Let's say in India, for example, it can cost 400, 500 bucks. So we couldn't, MSF didn't have that kind of funds. So we created our own spacer. I remember the nurses going to the bins, picking up saline bottles, which were used, cutting them in the shape of the nose, and we made our own spacer. And as you can see, we didn't have any nebulizers in our hospital, in our emergency department. Thankfully, there's enough evidence to say the nebulizer actually has no greater benefit than a spacer. Similarly, we had this case, typical, we had a lot of injuries which were happening, some related to the war directly, some routine injuries which were neglected because the government hospitals were shut down. Now, normally we are comfortable using things like propofol, fentanyl, all of that, but they had nothing because these were slightly more expensive than the good old cheap ketamine. So all we did was use ketamine for everybody, all age groups, because it's either this or nothing for procedural sedation and sometimes analgesia. I want to move on to one of the more interesting segments, which is the team. So as you can see, my team, so I was one of the A&E consultants. The second A&E consultant with me was on the left here. She's a Canadian consultant and wearing that scarf only because the local situation demanded us to adapt to what we may believe or may not believe in. And towards the extreme left is our translator because it was largely Arabic that the patients spoke. Again, if you see here, this was our steel tent. That was myself when I was a bit younger and probably less shabby, with again, two of them instructing on what we are going to do if the next wave of disaster strikes us. Fantastic local Iraqi doctors, extremely brilliant. The man on the right is the university topper in dermatology. And the man on the left is a consultant in orthopedics. Yet we all were part of the A&E team. They were willing to work as junior doctors. And just simple examples of the unity the country had. The dermatologist, board certified dermatologist, he'll manage an SVT without telling me because he thinks that's just a basic case. There's nothing to inform the consultant about it. And the man on the left, the orthopedic consultant, he'll manage neonatal sepsis. And he won't tell me because he thinks that's too routine. It's not complex enough to involve me. So these were just examples of how in adversity, a community brought in fantastic spirit. I've got 5 more minutes only. So I'm going to end this now with some more fun stuff. A team here of fun people. I was sent for 2 weeks to cover the Syria border because they had no doctors for 2 weeks. So I was sent there for 2 weeks and I met these fantastic people who could do funny things. Who would say this country is going through war? Just to cheer the kids up in the emergency department, some of the doctors were able to do fun things like that. Of course, wellness has always been an interest for me. I try to bring in some yoga every morning in the emergency department. So here, all of us practicing the Surya Namaskar. The fun part, of course, the guest house. We had food cooked by a local Iraqi chef, but on Fridays, they didn't come. So we had to make our own food. As you can see, I've got a British pediatrician, I've got an Australian midwife and a Canadian emergency consultant with me. All of us cooking different things and sharing food. If you're wondering who made that yellow dal, it was not me. It was the British pediatrician who wanted to challenge her dal making skills against mine. So that was hers. That is the Canadian nurse who was trying to threaten to kill me because I was constantly making fun of Canadians. This is the Japanese architect who actually built our temporary steel container. And as a parting gift after my 3 months in Iraq, he gave me some Kit Kat, which was matcha flavored. And they used to call me Sheikh Murtuza. And they gifted me, the man in white is me. They gifted me as a thank you gift, the local Iraqi clothes. And we all had a nice party in our garden. This was on the last day. the reason why we could even celebrate was because our location was the governor's house. We were staying in the governor's house. And if you're wondering why the governor was so welcoming for all of us, people coming from different parts of the world, he was not. The governor just ran as soon as the ISIS attacked. His house was just vacant. So, as part of the MSF deal with the Iraqi government, they gave us the governor's house. So, it is a bit more safe, our house. And that's why we could actually have this kind of a funny party on the last working day. So, thank you very much once again. I want to thank MSF, fantastic organization. Amongst many international organizations, they tend to have one of the highest ratings, not in terms of the salaries they give us, but in terms of the depth of work they actually do versus some of the other bigger names that you may have heard of who do the talking but will not do the walking. I want to thank you all for your patient listening. Apologies for some of the technical glitches on my end. I want to thank Believers Church Medical Colleges, the entire team. They've been very meticulous in their organization, specifically Dr. Jobin James, who insisted somehow to make this happen and try to make reasonable accommodations for me. So thank you very much. It's been a pleasure. I'm happy to hear any thoughts, any comments, or if the organizers believe we should do that in the end, I'll leave it to that. Hopefully I've finished on time. Thank you.
Thank you, sir. That was an interesting session. Audience, if you have any comments or any questions, you can ask now.
Hi,
Any
Murtuza.
questions? Yes, please.
Myself, Rahul, from St. James. I just want to know, Muthu, whether you people were prepared for any disasters. You were being attacked, or any such preparation were done. Were there any plan B in a case suppose you had to face?
Wow, that's a fantastic question. So, by the time I was there, so I spent 2 weeks only figuring out the visa process, security process. The Battle of Mosul was actually done. ISIS was formally defeated, but informally they were there in sleeper cells. So there were no direct attacks to us. There was just one explosion, which was again by the sleeper cells of ISIS. So from that perspective, nothing that I faced upfront, but a lot of security problems because there were a lot of landmines. So I was not allowed to walk anywhere on the road. The car takes you on only hospital, back home, hospital, that's all. For an eventuality, there were two types of protection. Our house had an underground sort of bomb protected safety room, which was a steel container inside our house. So at the moment it's activated, a code, all of us run to that place. That place has food, toiletries for 3 days and medicines for 3 days. So we can survive 3 days in that in case we were attacked until an international sort of help could come and save us from that place. I was also given a kidnap card just in case I was kidnapped for ransom by any local authorities. And my kidnap card had everything written in Arabic that if this doctor is kidnapped, you want money, call this number. And that number first checks whether I'm alive. So there's a code which only I know and one person sitting in Switzerland, which was the headquarters, knows. So if they ask the kidnapper, what's the code? And if I'm already dead, for example, the kidnapper can't answer that, then MSF won't even discuss how much how much ransom can be paid. But if they ask the question and I answer, then they check with Switzerland if that answer is correct. If it is correct, that means I'm alive. Only then they open discussion. So they have lots of security measures in place at an individual level, as a group level, tie-ups with the United Nations for a flight that can come and airlift us, our safety rooms and things like that. So if that answers your question.